Scientists are approaching improved verification of prostate-specific antigen (PSA) levels in the blood. Experts know that the most common screening test for prostate cancer often yields false positive results to such an extent that it is no longer recommended for men over 70. Currently, in some countries, it is offered as an option for younger men. However, during my review of medical news from various sources this week, I repeatedly found information indicating that researchers have discovered a way to make the blood test for prostate-specific antigen (PSA) accurate enough to significantly reduce overdiagnosis and better predict dangerous types of cancer. That is why I decided to revisit this topic to summarize the current information on it. According to researchers from Stanford Medicine in California, by calibrating PSA levels according to the genetics of each man, doctors can monitor other factors that may cause elevated levels. Scientists have proposed combining the standard blood test for PSA with additional genetic testing that identifies inherited genetic variants that may influence PSA levels. For those unfamiliar with prostate cancer and medicine in general, it is important to clarify the following. 1. Elevated PSA levels may be a sign of prostate cancer. However, PSA levels can also be influenced by other issues, such as inflammation, infection, simply an enlarged prostate, hypertrophy, or just advanced age. Additionally, it has been found that in some men, PSA levels are elevated on their own due to their genetics. This means that they do not have cancer, but a higher PSA level leads to a cascade of unnecessary medical interventions, such as biopsies. According to estimates, less than one-third of men with elevated PSA levels had biopsies that confirmed the presence of prostate cancer, researchers reported. Moreover, 15% of men with normal PSA levels were later found to have prostate cancer. However, healthcare experts are reluctant to completely abandon PSA testing, considering that prostate cancer incidence is rising in developed countries. The incidence of prostate cancer increased by 3% per year from 2014 to 2019, following 2 decades of decline, while advanced, by volume of organ involvement, prostate cancer rose by approximately 5% annually, according to the latest statistics from the American Cancer Society. The problem is that the signal obtained from current PSA screening, indicating a man's risk of developing prostate cancer, is often confused with background noise, the researchers explained. To improve the signal representing changes in PSA levels caused by prostate tumors, it has become clear that the noise, in this case driven by genetics, should be subtracted. For this study, researchers examined the genomes and PSA levels of nearly 96,000 men without prostate cancer to better understand the genetics underlying normal variations in PSA levels. The data were gathered from previous research and mainly included men of European descent. Through this analysis, researchers estimated that 30% to 40% of the variations found in PSA levels among individual men represent noise, determined by genetic factors unrelated to cancer. The scientists identified 128 specific regions in the genome that may influence PSA levels in men and then developed a tool to account for these normal genetic variations when calculating what they termed a polygenic PSA score. The polygenic score is a quantitative way to summarize an individual's genetic predisposition to a specific trait in a single value. Then the researchers compared their polygenic PSA score with data from a separate group of nearly 32,000 men without prostate cancer. They found that the score could predict about 10% of the variation in PSA levels. However, it was much more effective among men of European descent than among men of East Asian or African descent. The researchers then applied their findings to a mixed group of men with and without prostate cancer, confirmed by biopsy. The results showed that their PSA test could spare about 30% of these men from needing a biopsy. Adjusted PSA levels particularly improved the detection of more aggressive forms of prostate cancer, although, according to the report, the benefit was only evident in men of European descent. Another positive practical outcome of the research is that the genetically adjusted PSA better predicts aggressive disease. And this indeed sounds promising and hopeful. However, The adjusted PSA levels indicating the absence of suspected cancer were false in 9% of biopsy results. Most of these missed cases were slow-growing tumors that are not as dangerous and may not even require treatment. This outcome necessitates further improvement of the methodology. In this regard, the team of scientists is planning a larger-scale study involving more men from different population groups to further enhance the accuracy of the test. Ideally, a unified assessment of the test suitable for various age and ethnic groups of men is needed. Even a small improvement in screening could save lives. This follows from the rather disheartening statistics I found online. Currently, 1 in 9 men in the United States is diagnosed with prostate cancer, and 1 in 40 men in the U.S. is expected to die from prostate cancer in the future.